Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina, professor of University of Buenos Aires, ex-chief of plastic surgery. I have international recognition for my technique of endoscopic brow lift, eyelid blepharoplasty without skin resection. The main factor of the aging process of the periorbital area is more related to the ptosis, the eyebrow ptosis, than the flaccidity of the upper eyelid. Here we can see is eyebrow skin that going down to the malar area. Here this patient came to me looking for a resection in this area because this patient have a limitation in the eyelid field. This patient have problem to work for the diminution of the eyelid field. Here the wrinkles are spasm, frontalis spasm, due to the work that the frontalis to pull up the eyebrow, because all the skin of the eyebrow are over the eyelid lashes, limiting the visualization. And also this situation produces a sad and tired expression. Plastic surgeons around the world what are doing is resection of this tissue that more belong to the eyebrow skin than the upper eyelid skin. And if they make this procedure, they are going to reduce this fold, but the patient is going to have the same tired, sad expression that as before. The idea is not to resect this fold and pull down the eyebrow, because it's clear if you resect the eyebrow skin, you are going to pull down the eyelid lashes, and the expression is the same. All of us know is that this patient needs endoforehead lift. But what happened? This patient is almost bald, and if you make an incision here, it's terrible. It's better that remove skin here, eliminate the fold, and have the same sad and tired expression that to perform a scar here. And this is the procedure that we call brow lift. Is this incision. This is so dentate incision is in order to make this scar more inconspicuous. And all the skin that are removing is this one, and all are the incision to resect the skin in order to pull down the eyebrow, reposition the correct way of the eyebrow. All these techniques are for the same purpose. Here is endoscopic brow lift, but endoscopic brow lift also need 2, 3, 4 big incision of the 6 cm each one, and then it's impossible for a bald patient, and also this kind of patient have doubts about to perform or not perform this procedure. Then we can see in Asian patient the skin, and what I developed is 3 small incision of 1.5 centimeters. That this one is in the temporal area inside the hair, and this one here in the female patient or a man patient with hair in here. But if the patient have no hair, I make the incision in the front line, and then all this is produce inconspicuous scar that you can see. This is the conventional brow lift. All these are incision, and this is a comparison of the convention than what I'm doing. You can see no scarring. Conventional, my technique. Also this patient, no scar, I perform brow lift and rejuvenation with carbon dioxide laser. This patient went to many plastic surgeons, and all of them, including Europe, United States, suggest a skin resection in this area. But this patient saw my educative videos, and we have contact by email and also messenger, also video conference, and then we send the pre-op studies. This patient come to my clinic to be operated. I perform these procedures nearly 1 hour, local anesthesia plus sedation. The patient stay in my clinic near 3 hours, and we have no stitches, just only one stitch here, another stitch here. Then the patient can come back generally in a few days to their country, or other stay in VS to have a tours in this beautiful city, or go to the Patagonia or waterfall, whatever. But this procedure do not a constant consultation in the office. We can manage it by today's WhatsApp is the most. Almost have no complication, no stitches, no skin resection. All these situations make the procedures faster, to do the procedure faster, to faster recovery, and also do not the complication, because no complication is rare a situation of complication. You can see no scars, no skin resection, also here no scar, and you can see the tightening of the skin of the upper eyelid and the eyebrow. Generally I prefer to rejuvenate the full face, but women are easy to convince to perform the full face rejuvenation, but men are a little skeptical. They don't want a big change. They are more conservative. But what happened here is he only let me improve the skin of this area. But I extend a little bit more here. But all this I can rejuvenate with carbon dioxide laser. Another subject you can see that it is impossible with the conventional eyelid procedure to improve all this area. Just removing a thin skin here is impossible to ruin this area. Then a complete rejuvenation of the face need to improve the aging process. We need to improve the wrinkles, the flacidity of the skin. For this reason, it's mandatory the use of carbon dioxide laser. Maybe in the next time come another laser, but today carbon dioxide laser is the best. What happened is the use of the laser is another chapter in our process of learning. You know, we are medical doctors, we are general surgery, we are reconstructive surgery, we are aesthetic surgery, but there is not a school about laser. I make my own. I grew up with medical doctor of the Harvard University engineers, and also I work with a laser company. I develop my own laser. I teach laser all around the world. For this reason, I can give to my patient the ideal rejuvenation. Here you can see how the tightening and rejuvenation of the skin with carbon dioxide laser. Also, it's very important the reposition of the eyebrow in young patients. As you see, I avoid scar here, I avoid to pull down the eyebrow. Just reposition of the eyebrow without skin resection, tightening the skin with carbon dioxide laser, produce this nice looking view, beautiful view. You can see here. And also young patients come to me because they saw in my videos that this technique not only improve the aesthetic but also improve and increase the view field, because this patient was athletic, and for him it's very important to see much better, and this technique produced this. And also this patient, you can see how improve the view field, no, without leaving a scar. And also this patient. You can see another patient. That's all. If you need something, you can send us a picture to my office. My team and I, we are working in seeing what do you send us. We are going to study, we are going to communicate by internet, by video conference, and if you are sure, we can give you an appointment directly to operation, but always I talk with the patient before the operation. Sometime in the same day before the surgery. But you are going to receive all you need, and you are not going to lose time. You are going to be directly to come to surgery. I hope you enjoy this presentation. I hope this helped you in your decision. This is not a marketing video. I have more than 2,000 educative videos, and you can see a lot of my videos in different languages. Have a nice day.